Do you know that, while you are enjoying your life somewhere in the world, millions of people are forced to leave their homes, flee abroad, and struggle to survive in unfamiliar places? According to UNHCR, Pakistan, the largest host country of refugees in the Asia-Pacific, currently hosts about 1.5 million refugees, with about 1.3 million refugees coming from Afghanistan. There are 54 refugee villages with 30% of Afghan refugees living there.
The Afghans face wars, persecution, and generalized violence in their home country. They are forced to move away and start a new life in Pakistan, a neighboring country. However, as they are uneducated and unmotivated, some of them cannot receive healthcare service. They are both physically and mentally harmed. Therefore, we initiate a plan to help the refugees. The name of our program is Healing Hands for Refugees. In this video, we will first talk about the current situation and barriers preventing the Afghan refugees in Pakistan from receiving healthcare service. Then we will explain our plan in detail. Finally, we will conclude the video by a budget plan. Firstly, let's begin with the current policy and barriers.
Since more and more Afghan refugees are living in Pakistan, the local government has implemented various policies to protect their human rights and improve their lives there. For instance, refugees with poor cards have access to national health service at primary, secondary, and tertiary hospitals, including the national vaccination program. Moreover, poor card holders are included in social safety net programs to a certain extent. However, these measures are far from enough to protect their lives. Many barriers that stop them from getting the healthcare service they should have enjoyed. To start with, there are physical barriers. It takes a long time for refugees to register a poor card as they have to go through interviews and wait for approval and establishment. Some refugees fail to get the card even after decades of living there. Yet, national health service are restricted to poor card holders only. If they do not possess a card, they are largely restricted from traveling outside of the refugee villages. In terms of distance, the villages are far from urban areas. It takes time for them to receive appropriate and standard medical care service if they are in need. So some of them opt to borrow cards from others to gain access to public healthcare. In addition, in terms of financial barriers, most of the refugees are not included in some relatively new social safety net programs, such as public employment schemes, pensions, and health insurance. They live in extreme poverty and are unable to afford medical costs. Furthermore, there are mental barriers. They will be discriminated against by the locals since there are currently no national policy specifically addressing discrimination based on nationality, and the refugees are being seen as the cause of increasing crime rate. Plus, most of the refugees are low literacy. There will be fear that they are being deceived. Another obstacle for them is the language barrier. Misunderstanding between the refugees and the locals, including in medical affairs, are common. Due to these factors, they are discouraged to seek medical help in Pakistan. After talking about the barriers, it's time to explain our plan in detail. We divide our plan in 3 phases. The first one being an initiation, the second one being a follow-up, and the third phase being a long-term healthcare.
In phase 1, we will first tackle the difficulties of refugees to seek medical care. We have a plan called Outreaching Hands. This plan will be started in July 2023, in which outreach teams with healthcare professionals will reach out to the refugees to identify those with healthcare problems, to prevent deterioration of diseases, and to help patients with special healthcare, such as people with disabilities or chronic diseases. After the outreach, people with special needs or people who have notifiable diseases will be recorded and identified. Besides outreaching hands from healthcare professionals, there will also be other staff to reach out to the refugees living out of urban areas who are exempted from the national healthcare services to make POR cards so that they can access these services. To alleviate the language barrier, translated versions of menus and guidebooks regarding healthcare information, such as disease prevention and hygiene management, as well as the procedure of POR card registration, will start to be given to refugees living in remote areas and will be made accessible online at the same time in August 2023. For the financial burdens of refugees, we will conduct a research on most notifiable diseases faced by refugees through the obtained from the sanitary report system. and the research will be used to persuade the Pakistani government to increase the scope of free basic healthcare services, providing services that are expense-free to refugees.
Then, starting in October, we are going to start phase 2, in which we will give refugees more help. First, workshops named hands-on interaction with local citizens will be held to facilitate interaction between refugees from different regions and local citizens. Not only do we hope to reduce discrimination between the two parties, but we also hope to promote education for refugees before they can join a new life. Next, the refugee employment scheme will be started in November to provide job opportunities for refugees. Those who have already settled in Pakistan with stable jobs will be invited to share their experience as a reference for newcomers. Besides, employment training workshop will provide diversified pre-employment and on-the-job training, such as computer and communication skills to refugees. Considering those with disability and immobility, hotlines will be set up for them to contact healthcare staff and seek more medical help. Refugee-specified healthcare centers will be built to provide them long-term treatment, associated with health mentor program. Hence, a wider scope of refugees, no matter those with mobility or with disability, can access primary care services. Moreover, AI translators will be implemented at refugee-specified healthcare centers and public hospitals to give direct translation to refugees. Also, free language classes will also be given to them in December to tackle language barriers.
In phase 3, a phase to implement long-term healthcare service, the activities would start in February 2024. Firstly, a health mentor program led by several healthcare professionals such as doctors and NGOs in the refugee-specified centers and public hospitals would be held. This is used to build up relationships between healthcare professionals and the refugees, thus facilitating long-term monitoring of refugees' health and to minimize the reactivation of diseases. Secondly, talk about different healthcare topics such as environmental hygiene, over-reproduction, and misconception of disease management and the type of healthcare service available for the refugees at low cost would be held. The medical literacy of the refugees can be raised. They will have a better understanding of how to improve health standards of themselves.
With a total budget of $200,000, we will primarily focus on the allocation towards outreach events, employment programs, and an array of workshops and training courses to mitigate the barriers for refugees to access healthcare service. In phase 1, $53,000 will be allocated to provide medical assistance to refugees, complemented by informative guidebooks and a sentinel report system to facilitate the implementation of the following programs. Phase 2, the budget will be utilized to hire experts and instructors to deliver talks and guide the training courses. We will also cooperate with the Pakistani government, the NGOs, and social enterprise to facilitate the implementation of employment scheme as well as the construction of refugee-specific healthcare centers. Not to mention the utilization of the cutting-edge AI translator in public hospitals. The approximate cost of this phase is about $115,000. In phase 3, $52,000 will be spent to cover the health mentor programs and the topic sharing to raise the awareness of the refugees towards their health.
The aforementioned are the details of our program. Urban migrant communities such as refugees in Pakistan not only pose a severe threat to the country, but is also to global healthcare. Outreach and language assistance promotes health service and education to them. Meanwhile, identity and financial support reduces inaccessibility. Last but not least, cultural inclusion brings motivation. Our proposed program implements solutions involving all parties, from individual to community and to the government. Hands in hands together, we can alleviate the potential and existing barriers in respect to which refugees and the community's health in the aspects of physical distance, economy, language, identity, psychology, and healthcare system development. Thank you, and let's reach the urban migrant communities.